Hello everyone, today we will see the basic life-saving procedure called as CPR. The main objectives of CPR is to restore the partial flow of blood, oxygenated blood. It also helps to delay the tissue death and also extend the opportunity for resuscitation without brain damage. You should not have brain damage because you don't want the person to be paralyzed forever in his life. The above pictures show the different ways the CPR is done at different child groups. During an infant stage, 2 fingers of one hand are used and it is pressed 1.5 inches down. With children, it is used at 2 inches deep with one hand, and with adults, it is 2 inches deep with 2 hands. And it's very important. You can remember this mnemonic, that is ABC: airway, breathing, and circulation. To check the consciousness of the patient, ask him, "Are you okay?" loudly. Yes or no is enough. Lie the victim on the back and keep one hand on the forehead until the head slightly behind. After this, lift the tip of the chin using 2 fingers. This moves the tongue away from the back of the throat. This makes sure that there is no blockage of airway. When you check for breathing, first check whether the chest is expanding and relaxing normally. Then listen for the breath sounds by placing your ear in front of the nose and mouth. Feel for the breath for 10 seconds with your cheek. Agonal breathing is sudden irregular gasp for breath. If found, then perform CPR immediately. For circulation, check the carotid pulse and the radial pulse. If the pulse is feeble, then perform CPR immediately. You can see the radial and carotid pulse in the before pics. CPR is of 2 types: hands-only CPR and CPR with rescue breaths. The CPR in infants. Open the infant's airway by placing one hand on their forehead and gently tilting the head back and lift the chin. Remove any obstacles if seen. Then give 5 initial rescue breaths. Place 2 fingers in the middle of the chest and push down by 4 centimeters. The quality of CPR is very important. After 30 chest compressions at the rate of 100 to 120 per minute, give 2 rescue breaths. As I said earlier, ambulance calling is very important. Coming to CPR in children, as described earlier, secure the child's airway by removing any obstacles if present. Then pinch the nose and place your mouth over the mouth of the child and blow steadily. Give 5 initial rescue breaths. Later, place one heel of the hand and push down by 5 centimeters. The quality of compression is very important. Later, if compression with one hand is not possible, then you can perform with 2 hands. 30 compressions of 100 to 120 minutes should be followed until emergency services arrive. In case of CPR in adults, check whether the person has spinal injury. If there is no spinal injury, then you can perform CPR as same in children. But here, there are 2 differences. The first difference is that you have to perform compressions with 2 hands with depth of 5 to 6 centimeters. After that, you have to perform 2 rescue breaths after every 30 compressions. In all cases, whether infants, children or adults, until ambulance arrives, CPR should be performed. It should not stop at any stage.